My name is Dr. Louis Tornes, and I'm a neurologist and director of epilepsy at Baptist Health, Miami Neuroscience Institute. Medicine for me wasn't something that as a little kid I could say I've always thought about being a doctor. It was more something that as I got older, I started to think about more. My oldest sister is a neurologist, and that definitely played a role in me becoming a neurologist, and as well as my father, who actually had temporal lobe epilepsy as well, was probably another factor that played a role in me becoming a neurologist. So within my subspecialty of neurology, which is epilepsy, we see all forms of epilepsy that ranges from focal epilepsy to generalized epilepsy, juvenile myoclonic epilepsy, absence epilepsy. So there's a wide range of different forms of epilepsy that I see. So for me, the most satisfying aspect of my profession is basically the connection I make with the patients and being able to help them and see that impact that it has in how their life changes from treatment and me managing them. So the patient that had the biggest impact on me actually wasn't my personal patient. It'd probably be my father, who had temporal lobe epilepsy since the age of 3 following an incident of encephalitis when he was a child. So he had epilepsy his entire life, and it was drug-resistant epilepsy, meaning he was on 3+ medications and he was still having seizures. And I always saw not only the seizures, but the effect that the medications had on him in terms of this sedation or the secondary side effects of the medications. And when I was still not in medical school, he had temporal lobe surgery. He had a laser ablation of the area where he had the seizures coming from, and he was seizure-free after that. For him to have a simple surgery like that and then just be seizure-free afterwards was a pretty wow moment for me.